Hello everyone, welcome back to my channel, The Courageous Walk. I am Jacquelyn Reynolds, and today I have two wonderful colleagues with me, Jacquelyn McMillian-Bohler and Richard-Eaglin. So we're going to be talking about what are the ways that we can empower women of color in particular when it comes to accessing healthcare, being able to speak up when you're meeting with a doctor, and even in those moments where there's some hesitancy about whether or not we should go to the doctor. So ladies, let's jump in, right? What are some of the things that we should be thinking about? One is women of color, but really Black women when it comes to accessing healthcare.
Hi, Janelle. I'm so glad to be here and have this opportunity to talk to women out there today. And one of the things that I find to be most important for my patients to understand is that your body is yours, and it's something that that you have to take care of, you have to nurture, you have to respect. In order for you to be a healthy person and to live a long, fruitful life, you've got to take care of yourself all the way through the process. And we have things in our lives that are important, maybe our family, maybe our children, significant others, but we need to make sure that we place some priority on our health. And that is one of the things that we don't tend to do.
The level of vulnerability attached to going to a complete stranger, first of all. And then there's the power differential, because people often feel intimidated when they go and visit a provider. So just going and getting to know them, and typically on the first visit, it's usually about an hour. So it gives you time to kind of establish that relationship to a certain degree. And you should also write down any questions that you have for the provider, even if it's not about your health and you want to know in terms of, what if I need you after hours? Do you take add-in appointments, walk-ins, and all those kinds of things, and just see what type of relationship you can develop with the provider and what types of visits they offer. So will it meet your needs? You may be a working person that really can't take off work. Do they have after hours in terms of later in the weekday or on the weekends? Do they do telehealth, which is a big thing now? So it's just important to, as Jackie said, go in and establish that relationship and have that access early before you're sick.
Right.
And Angela brought up a couple of really good points about preparing for that visit and doing your homework. One of the reasons why we tend to be intimidated by experiences are because we just don't know what to expect. And anything that you can do to find out about that provider, there's so much information available on the web about providers and feedback and ratings and things like that that are there. If you have access to the internet, then looking up what concerns you might have and how other people have addressed those concerns may give you some questions. And Angela brought up the idea of writing them down. I cannot just express enough how important and how helpful that is, because I myself have been in situations where I walk in and I have a long list of questions I want to ask. I walk into the room and they just float magically out of my head and I can't even remember my name sometimes. So write it down. It is okay to have a list, a notebook of 25 questions that you want to ask. You may want to reach out to members of your family or friends who maybe are really good at asking questions, and run that list of questions by them and say, hey, is there something that maybe I should ask that I haven't asked, that you don't have to do this by yourself. So preparing for that visit, I cannot express enough how important that is to making sure you get what you need out of the visit. And that's what's important. It's what you need. It's not what the provider tells you. It's about walking out of that visit feeling heard, that you feel like you've gotten all of your questions and concerns addressed in a way that feels good to you. So if you walk out of the visit and you're confused, you don't know what's being said, what advice has been given, and you don't feel good about it, then that was not a good visit. And we need some follow-up there, or a new provider. But we've got to walk out feeling that we have really met our needs for that visit and we've gotten some answers to our questions.
Yes, and to piggyback off what you said too, you can also look on the internet if you have access, because many providers are there, and look at the reviews and the grades health grades sometimes. You don't want to go solely by that because people will give you bad reviews for different reasons sometimes for their own interpersonal things. But it's a place to start and get an idea, and it doesn't mean you shouldn't go and give a provider a chance, because with all relationships, some people gel well together and others don't for whatever reason. So I'm not saying to use it as that, but you can look and see, because oftentimes there are some pretty profound things you can. And then when we talk about internet access, you always want to make sure you go to reputable sites. And patients generally ask me a lot, well, what's a reputable site? So I'll give them a list sometimes, like WebMD, Mayo Clinic, Cleveland Clinic, the CDC, the Institutes of Health. Most EDU spaces or educational academic type blogs are really good. And if it's a healthcare provider who put the blog out there, oftentimes those are often reputable as well.
So looking for endings that end in .org would be another site that you can depend on, that has been looked at and the information has been validated.
Absolutely. So I wanted to come back to something that both of you said in terms of when you're in the room and you're asking questions. But what if you're trying to ask questions and the healthcare provider is not being helpful, or, bedside manner is atrocious? Is it okay to call a family member who might be more empowered to speak on your behalf, even if they're not able to physically be in the room with you?
Absolutely, you can do that within that visit. You can also leave. You don't have to stay. So if you're in a visit and you feel like the provider is not addressing your needs, they're not listening to you, they're not giving you a chance to express how you're feeling, you may end the visit. You don't need to, have a visit that is not on par with what you came in for. So you can also tell the provider, if you feel that you have space to do that, to say, I'm concerned because I have some needs that I don't feel like have been addressed. I have not, these are the questions that I've come in to get answers to. I haven't had these questions answered, and I'm concerned that this visit is not going as I planned. Sometimes people will respond to a correction. Sometimes that response to the correction lets you know that this is not the provider that you need to place your trust in. And just because they have a degree, because they have initials behind their name, does not give them agency over you. They have information that maybe you don't have yet, but you know yourself. You are your best provider. And if something about that visit is not feeling well to you, honor that, honor yourself, and either address it or end the visit.
And just my take on that, in terms of, we usually see signs in those rooms that say you can't use your cell phone. So if you feel that, then that is, I agree with Jackie, you should address it. Like calling someone else oftentimes will exacerbate the situation. If that provider is that way and you call that out, say, I don't know if I'm really liking the way you're speaking to me, like the tone you're using or something like that, and they get more defensive, and that's probably not the person that you should be seeing, because that is a reality and that does happen. And sometimes people aren't aware. As Jackie said, we're humans. So sometimes it could be about something else that happened and you're not aware of your behavior. So it is appropriate to do it in a non-threatening, non-disrespectful kind of way, non-confrontational way. And so hopefully if you do that, the person will kind of come back to why they're there and the purpose of that visit, and realize that their behavior, become aware of their behavior and hopefully correct it. But if they don't, I agree with Jackie, you should end the visit and leave, because that's not the provider for you.
Right. Mm-hmm. And I think if we're also considering the cultural ramifications, right, particularly women of color, even particularly Black women, we have been socialized to tell a story, right? So whenever we're talking about our experiences, it always comes out as a narrative. And that's sort of the way that we share details about what we're experiencing. And, so if you're coming in, one of the ways when you're thinking about, is this a fit or not, is that person open to listening to you telling your story? Mm-hmm. Or they just want you to give a list of symptoms? right? Because those are the things that which is why it's so important to find a match in terms of, like we would say, is there a fit? Is there a match? Is this someone that you feel that you can be authentic and vulnerable with? And, share the things that embarrass you, that you might not want to tell other people. If there's any sort of guardedness where you feel like you have to hide some of the authentic experiences, it's probably not the right fit.
That's a very good point.
Absolutely. And you may want to ask those questions when you talk to the receptionist about making the appointment. Ask, how long are these first visits usually scheduled for? So if you find out that your time with the provider is 15 minutes, for most of us, that may not be enough time to tell our full story. So that the time that's allotted for your visit may give you some information about what kind of provider this is. Now, again, that's not to say that everyone wants a provider that will spend lots of time with them. That's not what everybody wants. Some people want a provider that is really efficient because their time is really, they need to keep it short and sweet, and that's what they want. And so if that's the provider that you feel meets your needs, there's nothing wrong with that. But those are things you want to check out ahead of time so that you have a relationship with someone that looks like what you need.
Right.
Yeah. And typically the first visit is the one that lasts the longest, and those of us who want to exceed what maybe the minimum standard is, we'll schedule a longer visit so that we can ask you questions, you can ask us questions, and create that foundation for that trusting relationship. And authenticity will be extremely important regardless to the timing of the visit. So, and then if it is a shorter visit and you need more time, as a patient, you need to feel empowered to say, can we schedule a longer visit next time? Because maybe this time you did only want to, like Jackie said, take care of that one thing, or you may not have that much time. But if you want to do something that's of more time next time, you need to speak up on that too. Ask, rather, if that's a possibility.
So how do you make a decision about getting a second or third opinion?
For that one, any major decisions, if this is a decision that's going to significantly change your life or your lifestyle, it is never a bad idea to get a second opinion. So if it's surgery, if you are going to, if you're dealing with having surgery specifically maybe on your uterus and you may not be able to have children afterwards as a result of that surgery, then that might be something, if that's important to you, that's worth a second opinion. A decision to have a hysterectomy, a decision to have your ovaries removed, a decision to do any sort of preventative services in terms of cancer, so mastectomy, anything like that that would involve something life-changing is worth having another opinion to confirm.
So do you just, so how do you make those decisions, right? Because let's say this is your primary care doctor. Do you just ask them to recommend other people, or do you do it on your own? Like, what's the sort of like the appropriate way to go about getting a second opinion? Do you tell the new person that you already have a first opinion? Is there, etiquette around this?
I think when you're thinking about etiquette, when you're doing things like that, that means that you are giving someone else power. You are making yourself more concerned about how the provider feels than something that's ultimately going to mostly affect you. So the first thing I would push back a little bit, Janelle, about your statement is that it's your body. And so you're allowed to ask whomever you want, how many times that you want to ask about that. So I think we have to really change our language about our healthcare so that we feel empowered to do that. So if you want to tell your provider, I respect what you're saying, I hear what you're saying, this is a big change for me, and I would feel more comfortable if I spoke to someone else just to confirm that I'm doing the right thing, that I'm making the best decision for me. If you're with a provider that respects you, they should understand that. And if they don't, that may be a sign that you're with the wrong person. Disclosing that to another provider that you've seen someone else, there's nothing wrong with that. They hopefully will know that that's what's going to happen because you brought records with you or something like that, so they can compare. So they may know what the recommendation is, but there's no need to be secretive about it. So if you want a second opinion, you should feel free to be able to ask for that. Whether you want to ask that provider or not is up to you. You may have another another avenue, another person, another friend, somebody else that you want to ask in that way, and that's fine. But they should be open to that, especially if it's a significant outcome that's going to happen as a result of that treatment.
Oh, I like that.
Oftentimes, some providers will say that, when it's major. Again, it's all about how conscientious that person is. And I think that most would be open to that because if you think about your own humanity, and if you want a second opinion, that's fine. And also, to piggyback to what Jackie just said, when you go to that second person, it is important to be transparent in terms of, I need to know what has already been done for like diagnostic testing, lab work, any meds you're already on so that I don't repeat something, and also to know where to pick up from. So when a patient is coming for a second opinion, that part for sure you don't want to hide, because that may come across as you are hiding something, because there are those circumstances as well. So it's important, again, when we talk about building trusting relationships, that honesty with the second provider is extremely important, because I do need to know where to go from here and why you're here and where should we go.
Well, I like that I'm hearing that the responsibility and the power is not in the healthcare provider, but really in you. And just because this person has made a recommendation or has said X, Y, Z does not mean that you have to accept it as doctrine. It is okay for you to talk to other doctors that do similar things, to get other input. And maybe the second person that you're going to might have the same findings, but their ability to explain the process to you, maybe what you need to better understand what's coming. So it's not just a second opinion because you're expecting a different result, but the experience in and of itself could be what empowers you to feel like maybe this really is the right decision for me. Does that make sense?
Mm-hmm.
Yep, that's a great point too.
The only thing I would make in terms of getting a second opinion is be careful and conscious of the time frame. So if you're dealing with something that needs to be dealt with in a timely manner, don't wait. Don't use that as an excuse to not address what's going on, because another thing that happens sometimes is we tend to deal with things by denying it, and we're getting ready to. I'm going to get to that, and that I'm going to get to take 6, 8 weeks, couple of months, 6 months, and we don't get back to it, and time may be of the essence. So don't use the need for a second opinion in a way that might put you in a different situation or impact your outcome by waiting too long. So if you want a second opinion, you need to address that perhaps very soon. And that may be a good question to explore when you're considering getting that second opinion. How long do I have? If I wait, if it takes me 3 months to get an appointment with someone else, is that a time factor that's going to affect the outcome of this decision?
Yeah, and this is a good place to add in another one of those cultural influences, especially in the Black community. We do wait. And then if you're a provider, you often do wait. Unfortunately, we do. I just had a conversation with another nurse practitioner yesterday who was notorious for that. And she's in the exact situation Jackie just described. She waits and waits and waits, and now she's in a situation where her issue has become much more severe, to the degree that she's seen several providers and no one even knows what to do with it now because it has gotten out of control. Like it's bad. So that's a real life situation. I thought that was a great place to bring in that example. That's real. Like, you need to not wait, regardless to what your reasons are, because just because you deny it, it doesn't mean it's going to go away.
Mm-hmm.
It will get worse. And you talked about Janelle. I usually do have lots of stories. So that brings me to this Black patient I had years ago who had breast cancer. I had never seen anything like this in my life, and I haven't since then, but she knew she had a lump in her breast, and she waited and waited and waited. By the time she sought health care, her breast literally was like a rotted orange. It was black. It looked like you could grab it and break it off. So that is what we do. And she, I talk to her about it all the time. People, going to your point, we like to tell stories. So she told me her story multiple times. We talk about it, and it's not that she didn't care, but she was afraid for one thing, and then also just kind of in denial until it got to that degree. So those are extreme examples, but just knowing sometimes that happens sooner rather than later, depending on what the issue is.
Which I think is a good point for me to bring up some of the work by our colleague at UNC, Dr. Woods Giscombe, and her concept of the superwoman schema, which is unique to women specifically, but more towards Black women. This idea that we have to be the superheroes, you know, that we have to carry the weight of the family, the weight of the world, the weight of the community on our shoulders, and not take a moment to say, you know, I don't feel good. You know, I'm tired. This hurts. We just tend to suck it up. I don't know, that was my experience growing up, that you suck it up. It's part of life. Women suffer, women have pain, and we work through it. We make a way out of no way. I have all kind of grandmother-ism statements that I was given growing up to say that, you know, you don't get to complain, because to complain about how you feel implies weakness. And so that's something that's ingrained into us from a cultural standpoint that we have to undo, because that is one of the reasons why we wait. We don't just procrastinate because we procrastinate. We procrastinate because we put everybody and everything else first. If it's not our family, it's work, it's church, it's school, it's something. And then our bodies are the very last piece of the puzzle. And so we have to think about it like when you're on the airplane, you know, you've got to put the face mask on yourself first. Because if you go down, you're going to take everybody else down with you. So you've got to make sure that you are a priority, and that self-care and medical care and checking on things, and not just once they're bad, but in a prevention sense, that can we take care of things on the front end so they don't have to get bad. There are times when we can find issues before they start, and they never have to get to a place where it's an emergency or we're talking about a life or death situation. So often we miss the boat because we wait. For lots of reasons.
Yeah, and I want to tag on to that and say the other thing is that we as a culture, Black people, pride ourselves on resilience. And then we also think about that generational thing, like our ancestors who were slaves, who kept it going. And sometimes it's other reasons. I feel like I can't afford to take off work, because if I take off work, then I don't get paid. And how do I pay my bills? So it's multiple reasons why. Not just Black women, but we're talking about Black women, but people who are, the new term, economically exploited for some reason. Like sometimes it just, your health can't be, even though it should be, your priorities. Hopefully with us kind of driving home the point of the importance of caring for your body, because when you're not healthy, again, going back to the mind, body, and spirit, then you can't do all those things and be that superwoman to the best of your ability and take care of your household, because eventually your body is going to start to suffer, and then everything else will suffer as well in your life. Like all those things that you're used to taking care of, you won't be able to. You may not even be here to take care of them, as Jackie said, because some of those things, if you catch them early, I used to make jokes with my patients and say things like breast cancer, prostate cancer, colon cancer, and I would say it to be make light of it, yet to show you the seriousness. If you come in early, it's a matter of you can cut it out and throw it in the trash can. I'm like, we don't literally throw it in the trash can versus you losing your life, but we could just take out that bad piece if you come in early. So some of those things, it's extremely important. Same thing with hypertension. We don't want to come in and take the medication for whatever reason. And then if you wait, people don't realize that hypertension doesn't necessarily hurt you, you know, in the moment, but it hurts because by the time you find out, you have heart damage, you have vascular damage, you might have a stroke. So those kinds of things, if you come in early and allow us to catch it early. Same thing with diabetes. We're going off the women's health thing, but that could all be parts of it. But that's also why you want to come in and not just come when you're sick. You maintain that visit so we can catch those things early, and sometimes we can do things to reverse those or prevent them even better.
So what about, so those are all very helpful, you know, but I can't help but think about the women who do not have health insurance. And so their only access is to go through the emergency room. And so if you're going to the emergency room, you're already sick, right? So there's not enough time to, do all of this, the depth of preparation, like someone who is, just being preventative. Can these, tips that you're offering be applied in the emergency room as well while you're already sick? Or is there other things that they should be considering when they go into the emergency room?
So most of my career has been with people in the predicament you just described. And there are several clinics that are available to people who don't have insurance or underinsured. And it's just knowledge of those resources. So if you did access the emergency room, hopefully they're giving you some options for some of those other clinics. If they aren't, then the way to empower yourself in that way is to ask, is there a clinic that there's some fee for service clinics? They're called federally qualified health centers. So with those, either it's a little to no copay. So there's something out there, and sometimes people may not tell you, and we don't want to, again, as Jackie said earlier, give people that much power over you that if they don't tell you, you don't know to ask. So hopefully us talking about it here. So if you did go, you don't want to continue to use the emergency room as your primary care, because there are those clinics that exist, and many of them do offer after-hour services. So if a patient says, well, I had to wait until I got off work, so I just came to the emergency room. Nope, some of those clinics are open after hours. And then there are also clinics in several areas that, even if they're not a federally qualified health center, there are some clinics set up where people just kind of do that volunteer kind of work. I used to work for a clinic like that as well, where we also, all of the providers in there, and it was physicians and nurse practitioners, we tried to connect people with other people in the community who offered similar services. And there's always a way, and social workers also play a huge part in helping patients who are uninsured or underinsured find those types of resources.
Excellent.
And reaching out, some families are very active in the church. Some churches have parish nurses. But often as part of the outreach of the church, if they become aware that people are under-resourced and they need help in that area, they can also be a voice to help identify places. The health department usually will have a list, and those are some options of places that you can go to look for those kinds of services. But getting back to your original question, in terms of the emergency room, it does not replace primary care, which are those day-to-day sort of issues. So if you're using the emergency room as a place to get primary care, it's probably not going to be as helpful as you would like for it to be. It's also very expensive. And so sometimes at the end of the day, you end up racking up a bill that ultimately can put you further behind in terms of financial gain. And so thinking and really being thoughtful and planning ahead for those preventative services may save you from being in a situation that you have to go to the emergency room in the first place, but certainly not have to go repeatedly to get an issue that's really better addressed by a primary care provider.
That's great. So I think that we covered preparation, what are the preventative things that you can do to get you into the doctor's office, and what you can do to be empowered in the doctor's office in terms of your communication with the doctor. And for those who this phase is not necessarily realistic in the moment, because for whatever reason, whether it be finances, location, geographic location, etc., there are services that are available. It's just a matter of talking to people in the community so that they can help you find those resources that may not be publicly, they're not on billboards, or it's not there unless you know people. So I think we've covered the gamut of things that women of color, Black women, should be thinking about in terms of their health and getting them in the door to talk to their doctors, their nurse practitioners, any kind of healthcare provider that is necessary, from your dentist, right? Because these things apply to major surgery, right? So you're not putting people on different pedestals. It's human interaction requires respect. And you need to be able to feel empowered because as Jackie likes to say, it is your body and you have the final say in what happens. Unless you're unconscious and someone else is making that decision.
That would be the only time that I would say you've got to let go and let other people and let God take care of it. And that's pretty much it. But, you know, it's just remember, I think if you think about your body is not less important than, you know, your dress or your clothing that you go to the store and buy, you know, and being mistreated by your hair. Oh my goodness. Now, don't get me wrong. I'm a Black woman. I totally get your hair is important. That's your crown. I get it. But if I have a hairdresser and they don't listen to me, they don't cut my hair like I like it, they don't make me feel comfortable, I'm not going back. And we need to have the same sort of level of respect for ourselves as we have for all of these things that are superficial. Because, you know, you can cut my hair off. Hopefully it's going to grow back. Hopefully. But if something's done to my body, it's in some cases not recoverable. And if it's not recoverable from a physical standpoint, the trauma that you may begin to feel emotionally then sets you up for not trusting anybody. And that's how we get down this road of this self-perpetuating idea. And you have a voice, you have one. And it's so important that we practice using it. And if you don't feel ready, bring somebody with you, and that is okay. It's not weak. The strongest thing that you can do is make sure that your body's healthy and that your mind is strong and that you ask for help when you need it. That's actually the best sign of strength, is that you ask for help when you know you're in over your head.
Absolutely. Angela, any closing words on this?
I second everything Jackie just said, because I mean, the other side of that, and I'm going to bring a controversial statement in there. So just knowing where that comes from, sometimes why we do those things and we don't speak up and we feel intimidated just to bring all that home. It is being Black in a predominantly white world, and we go to a provider that may not be a Black person. So you do either one of two things. You don't fully trust, so you don't speak up as you would. So, and I just want to close out by saying, if you feel like you need to have a Black provider, and if it needs to be a female, let it be a Black female. If you're okay, just as long as they're Black, male or female, but find somebody you're comfortable with is the bottom line, and who you feel like understands you, and that will allow you to empower yourself to have control over your body and your health.
Right. And just know, just because the person is the same race as you doesn't mean that the two of you will be a fit.
Oh, so true. So true.
So you have to really be open to, you know, whoever you start with. It's not just about race, but however that person is from a similar race or a person of color, etc., might be more open to some of the cultural things that you're used to, but it doesn't mean that personality-wise, etc., that you're a fit. Right? So
that is so true, because I hear that a lot, and I used to not even speak on that, because personally I feel like it doesn't matter. I'm under the same belief that you just said. As long as you can meet my needs and I feel a connection, it doesn't matter. But then I hear so many people in the African American community say that they would prefer that. So I'm glad you made that point, because you may go there and still not be satisfied. So don't let that be the sole reason why you choose a provider. So thanks for bringing that point up.
Representation always matters, right? The more options that you have, the more people that look like you, the probability of you finding a fit within the people that look like you is much higher. But if there's only one or two, you know, it's at that point, it's about luck, right? Maybe you're a good fit today and maybe not tomorrow, but that is okay. It's you that is making the decision about who is the right fit for you for this particular situation. And if, you know, after a few visits, you know, you realize, I don't really feel like my needs are being met, and it wasn't just after one session, but it was after multiple sessions, it is okay to find someone else. Right? Because it's about being empowered. So on an empowered note, thank you all for being here. Everyone, don't forget to like, subscribe, and click the notification bell so that you would be aware of any more sessions that come up. Thanks, everyone.
Thank you.